All right. So I am with Dr. Lisa Oldson. We actually talked before and recorded this, but mistake on our end. We didn't actually record the audio. So we're having a follow-up conversation. I really appreciate you doing this. Yeah, well, I'll let you further introduce yourself.
Introduce?
Yeah.
Sure, sounds good. Well, great to be back, even though it was inadvertent. So I'm Lisa Oldson. I'm a physician on staff at Northwestern Memorial Hospital in Chicago. And just briefly to let you know my background, I did primary care for the first part of my career, so I have a lot of experience doing that. The past 7 to 10 years, I've really shifted my focus away from primary care. I've done a little health tech consulting, but most of what I have done is to focus on obesity medicine, which is actually a new specialty, and I'm board certified in that. And basically, I help people lose weight. So I have a small private practice fully focused on weight loss, weight management, and to some degree also addressing the many comorbid complications that come along with excess weight: diabetes, high blood pressure, sleep apnea, depression, arthritis, cancer, heart disease, those sorts of things. So that's me.
Cool. Well, yeah, and so the reason why I was excited to connect with you and why we're doing this is, there's a lot, and we've talked to people, on the front lines, really, fighting this. But then there's also, all the people at home that are, sitting at home and kind of, well, one, wondering what to do, but then two, trying to stay healthy and, get through this. And so I think your perspective on, just what you're seeing would be really good. And then yeah, like maybe some, we can start brainstorming and maybe some solutions to some of those problems too.
Sure. Well, one thing that's been really interesting to learn about the coronavirus is that we're seeing people who carry excess weight have a much higher rate of serious infection and death. And so it's not really clear why. It's not just that people who have any chronic disease have a higher risk of infection or death, but specifically high blood pressure, diabetes, and obesity. And obesity in the medical field is defined as having a body mass index, or BMI, of 30 or higher. And so, which actually, more than a third of Americans do fall into that category. If you look at people who are overweight, a BMI of 25 or higher, including people overweight or who have obesity, that's 2/3 to, getting close to 3/4 of people in America struggle with their weight. And so that makes my clients, my patients, a lot more vulnerable to this virus. And so I don't think it needs to be, I don't think people have to feel like it's superficial to be worrying about their weight and trying to watch their weight right now. Coronavirus is going to be with us for a long time. So if you're at home, if you are currently well and you have the time to focus on your health, it's a great time to do so, because that's one way you can protect yourself.
Yes. Well, and I know when we were talking last time, it also can be somewhat of a difficult time to do that as well. And so, I think maybe, as far as what we can do from a software perspective, there's software is really good at getting people information. It's really good at connecting people, motivating people. So it would be awesome to, maybe just talk about, ways that you see people being motivated to be healthy, or even just some of the problems around like what we're,
Sure. Well, so one thing that already exists is there are a number of apps out there to help people with their health, with their weight, with meditation, with sleep, with mindfulness, with exercise. There's so much available. But I think there's still room for a lot more. And one thing that I've been thinking about is space for people on a more local level to create a support community around that. So it's one thing to be on the Weight Watchers app, which I think is wonderful. I'm a fan of Weight Watchers for people. And I think they've made some awesome improvements to really put their program in line with what the latest science says. With Weight Watchers, it's a big community. So whenever you can make it a little more local, I think that's helpful. That's why Weight Watchers had small local meetings. But I think there's a way to do this. When I think about software and I think about what people can do, I think on a local level, figuring out how to help people connect and support each other. So coming back to the idea of weight, we know that people do better with their weight if they have a supportive community. That can be friends, that can be people in an exercise class, going to a group nutrition program. It can be having a health coach. It can be having a neighbor that you walk with, whatever it is, but some sort of social connectedness around the process of taking care of your health and your weight is very helpful. And so I think there are probably ways that someone could develop, even just building on things that already exist. For example, in my neighborhood, we use the Nextdoor app a lot for everything from, whose lost kitty cat is this to who's making masks. I think those kind of little connections, and maybe doing that around health support. Sleep is a really big thing too. We know that when people aren't sleeping well because they're worried, they're ruminating, maybe they're stuck in a small apartment with someone that they're not getting along with, or they're having a hard time helping their kids with remote learning, whatever it is. When people are tense, when they're stressed, they're not sleeping well, that contributes to poor health outcomes. It contributes to trouble with weight. Stress does, sleep does. I always say for my patients, the 5 S's, we have to get the 5 S's in line. So sorry, I'll have something racy in there. So it's sleep, stress, social connections, it's sugar, and it's sex, which really I use as a proxy for like a healthy, loving relationship. So, or
I think everybody
whatever.
knew what the last S was going to be when you said
Yeah. You can make that whatever you want it to be.
Yeah,
Everyone's got their own thing. But I think the 5 S's might be a place for the people who are volunteering their time to brainstorm. How can we get people to put their 5 S's together? Because if you're sleeping well, if you're managing your stress, if you're not eating too much sugar, and really that's just a proxy for healthy eating, if you're socially connected, if you have a good support network, even if it's not even if you don't have someone at home and social distancing is impacting your support network, just figuring out creative ways, how can you connect? Just for example, these video chats, it probably seems like everybody's doing them. It seems like that to me. But I'm sure there are a lot of people who aren't. Loneliness is an epidemic in our society, and it impacts health outcomes. It impacts weight. And so I think creating some sort of connection, not everyone knows how to create a Zoom account. My parents are struggling a little bit. Well, one set of parents has figured it out and they're having wine with their friends every night. And the other set of parents, they're still kind of trying to figure that out. So improving social connectedness too.
Right. So, I like that idea. It's it's the community aspect, and it's not a lot like necessarily accountability, but it's just a community. And right now, especially given just what's going on, there is a lack of that. And so, building something that can help connect people in smaller into smaller communities, to stay healthy, when it's just tough right now to do that. And
And I think accountability can be positive. You know, like when people come to me for accountability, sometimes they really want me to hold their feet to the fire and, you know, speak to them like I'm a boot camp instructor. But most of the time, that's really not what inspires people and motivates them and helps them to do well. What the research on behaviors tells us is that when we can catch a positive behavior and then reward that, you know, just with praise or whatever, however you want to reward it, then you can amplify that behavior and get it to happen again. So rewarding that behavior is a really nice version of accountability, finding all of the successes, worrying less about the negative things. And so if I were to create a community for supporting the 5S's and figuring out how to build in accountability, I would maybe make a support section where anyone who wants to can identify something positive and shout it out. You know, like one thing I hear you doing really well is you're forgiving yourself for that ice cream you ate yesterday. Or one thing I hear you doing really well is you ate some cookies, but then instead of skipping your next meal to kind of punish yourself for it, instead you nourished yourself with some healthy broccoli at your next meal, or you know, whatever the healthy choice is.
Well, and that's really interesting. So another person I spoke with earlier this week, had, you know, who works with people that have PTSD about stress, is, you know, really kind of right now it's there's a lot of negative news, there's a lot of things happening, and having, you know, being able to look at the positive, even though it's difficult, is really how we can, you know, start to de-stress ourselves a little bit. So I think that falls right in line with what she was saying. Absolutely. in you know, but specifically food and health, like, you know, health and nutrition wise. So I think that's really there's definitely something there. And I think, you know, the designers, as a part of this can probably have some fun thinking of ways to you know, reinforce positive. Through software.
I think so too. I think that's really critical. On social media, there's so much negativity. So we could use a place with positive support. And one thing about, it's interesting what you were saying about stress management and PTSD. One thing we know is that stress management takes practice. And so you're not going to suddenly manage your stress perfectly by, you know, not doing anything and then doing a 1-minute meditation and I got this, now I'm relaxed. And, you know, you have to practice like any skill. So if you want to learn to play the cello, you are not going to just pick up that instrument and assume after trying it once or twice, you're going to know what to do. Instead, you're going to practice a little bit every day. And so practicing gratitude, deliberate gratitude, mindfulness, and other stress management techniques can really help you develop those skills, and then you get good at it. So the Mayo Clinic does a lot of really good work around this. And I learned some of the things that I teach my clients from a course that I attended there and a book that I read that they published on stress management. And I really like, one thing they emphasize is the value of gratitude in managing your own stress. So you might feel really overwhelmed because you're sheltering at home, you're lonely, you lost your job, you can't pay your rent, and you're eating, you know, canned beans, and anyone would feel really stressed and overwhelmed by all of that. But if you can start each day just saying, I'm going to think about 5 people who I'm grateful for. And I'm just going to put a little positive thought out into the universe for those 5 people. You don't have to call them. You don't have to do anything formal, but just maybe in bed in the morning before you get up and get going. But that's a great way to reduce stress. It's just every day, very deliberately, think of 5 people you're grateful for or 5 things you're grateful for, and start making that a habit. It's a great stress reliever.
Yeah. Awesome. Well, yeah, I think that, you know, it would be cool to have some maybe an app or something that could help with that too. I don't know.
Yeah. Like people just throwing out their gratefulness, or like pinging you, hey, what are you grateful for today? You know, you've only gotten 3 of your 5 things. So
yeah. So well, I really like that. And I think that ties back into like the positivity aspect too, right? Because if you're being grateful, you're thinking about about positivity and, you know, so a few things that we talked about last time that I wanted to touch on, and you just demoed it for us a little bit. You mentioned NEAT.
Oh yeah.
How that you know, how that's something that has kind of changed for a lot of people given this. And so I don't know if you can explain that again, because there might be something there as well.
Great. I would love to talk about NEAT. So NEAT is an acronym, NEAT. It stands for non-exercise activity thermogenesis. And what that really means is the calories we burn just going through our regular day. So that's not deliberate exercise. That's not it. You know, when you hop on a treadmill or your Peloton or lift your weights or go for a walk, but instead it's just, you know, I'm walking from the 3rd floor down to the basement with my laundry basket. I'm loading and unloading the washer and dryer, walking back up. I'm folding the clothes up by the bedrooms. I'm putting the sheets away after I fold them, all of these kind of little day-to-day things. So I think most of us, it's not universally true, but I think most of us are getting less NEAT right now. So if you think about a typical commute where I live in the suburbs, most people, they walk to their car in the morning, they hop in the car, they drive to their office, they walk from the parking lot into the building, maybe in the building, they leave at lunchtime to go to a cafeteria or someplace to grab lunch, they come back. And so all of these little movements we would get during the day, many of us are not getting those anymore, or much less so, because now our commute is literally, you know, my bed's over there, my desk is over here, and 20 steps that way is the kitchen. You're hardly moving at all. So we have to kind of figure out how to add in more NEAT. And so that's why having these at my desk, you know, that prompted you to think about it. In a way, you know, I don't know if I would call that NEAT. It's deliberate, but it's just some kind of movement I'm getting during the day that's separate from going and working out.
Right.
And so even like underneath the desk, so if I'm on an audio call, I'll get up and pace and walk. When I brush my teeth, I'm lunging and squatting, and my husband thinks I'm crazy, but trying to add in little bits of movement throughout the day. But even now, if I'm on a video call and I'm sitting at a desk, my husband has a little pedaler under his desk because he works from home often enough. We've bought one of those. I don't have that. All I'm doing, if these are my legs, I'm just straightening them and, you know, putting them down or going up and down on my tippy toes, but not sitting immobilized. So anyway, I think moving as much as you can, increasing your NEAT, inserting NEAT into activities that you normally do during the day that don't usually incorporate it.
I mean, so maybe there's just like, you know, there could be potentially something that people build. It's just like, you know, NEAT habits or something like that, that kind of like give people tips to, you know, hey, this is things you can do during the day to just keep your body engaged, you know,
moving. Yes.
There was 2 other things I really wanted that from our last conversation that I really wanted to talk about. One, which you just mentioned, was nutrition. And I think you had some really good points about nutrition when we talked last time. And specifically, because a lot of people are financially struggling right now, you know, some ways to do that in an inexpensive fashion. So it would be awesome to get some of your advice on that. And then the second was we ended up talking last time about homemade masks and delivery services and things like that.
Oh, yeah.
And so it would be, you know, we can just touch on that really quickly. But yeah, I wanted to make sure that we got to those 2 points, because I thought that those were potential, you know, interesting
Yeah.
Software.
Oh, I'm sorry. I crossed my mind that I should start the interview with one of my crazy fabric homemade masks on. I forgot. Let's talk about nutrition really briefly, because poor nutrition is the #1 cause of preventable death in the United States. And a lot of people have food insecurity right now, many of whom have never experienced that in their lifetimes. And so some advice I can give about things that are more affordable. A lot of times frozen produce or canned produce, fruits and vegetables, will be more affordable than fresh. So that's a great option. And that's something you can buy and let sit on your shelf and not risk that it's going to go bad. You know, if you're buying fresh avocados, it's wonderful, but you can't, first of all, buy that in bulk because they'll go bad. There's only so many you can buy at a time, and they're expensive. So, you know, things like frozen broccoli, frozen fruit, canned beans are a great resource. They're really healthy. They'll give you some protein. They'll give you some fiber. They have some healthy fats. Canned beans are great. So I think last time I told you, I like to make bean bowls. It's really super basic, but to me, this can be a breakfast, a lunch, or a dinner. I just rinse a can of black beans. I like to put a little canned tomatillo sauce on it, but any kind of salsa, or if you have tomatoes, onions, cilantro, fine, great. If you have avocado, a little avocado on it. If you have some store-bought pre-made guacamole, that will last longer. You can put some of that on. If not, that's fine. I also love to put an egg or two on my bean bowl. So I'll make a poached egg or an egg over easy, or if I have a hard-boiled egg. And, you know, it's all warmed up in the microwave. It's really delicious. It's really simple and packed with nutrients. So I think when you're looking at limited resources and maybe limited cooking skills, I mean, that's another thing for developers to think about, you know, sharing basic cooking skills. We are not taught that in the way we should be taught that. A lot of my clients don't really know how to cook. And I'm not saying to make glorious recipes that you get off, you know, that you got from Gourmet Magazine or Epicurious or Bon Appetit or something, you know, just like pretty simple basic meal assembly. That might be something else. Like, this is your first time cooking for yourself, you're sheltering at home. Here are 20 quick lessons that every home chef should learn for just very simple basic eating. That would be, I think, useful. Learning to read labels is another big thing. When a label has maltodextrin, xanthan gum, soy lecithin, mono and diglycerides, that's not real food. That's a lot of chemicals, and that's an ultra-processed product. And if you can find a real food product that doesn't have all of that, that's a better choice. So, you know, getting food that is more from the produce section, the meat section, the frozen section, meat, deli, you know, fish, those sections, as opposed to the things that are in a box or a container that can sit on the shelf for weeks or months or even years without going bad. You know, these ultra processed foods are killing us. They're really very dangerous for our health and a real source of weight gain for people. So
yeah, and what's cheap and easy to get right now too. So
right.
So yeah, I think that it's, you know, hopefully some team picks up that ball and runs with it.
I hope so.
Cool.
You know, what would be interesting is to take, for a team to take, like, here's a list of ultra processed things that might be quick and easy. And here's how you can make these same things in a somewhat affordable fashion. And here's a video on how to make it. So an example, like what I will explain to my patients, if you want to know the difference between an ultra processed version of a food and a real version of a food, like think about a beef, broccoli, lean cuisine type of meal that's got red meat, it's got broccoli, it's got some sort of a sauce, like an Asian flavored sauce, and some brown rice. Now think about that same meal where you just get an inexpensive cut of red meat, have more vegetables than meat, get some frozen broccoli, maybe an onion, chop that all up, stir fry it in a pan, throw some soy sauce on it, make some brown rice. You know, you can make that pretty affordable and make enough to last for several meals. And that's real food. That can be a weight loss or a weight neutral meal. The ultra processed version that can sit in a freezer for 2 years, that's more likely to be a weight gain product, even if the calories are the same.
Interesting.
Because it has all those ultra processed ingredients. So
yeah.
yeah.
Well, I definitely want to try to get some like resources from you that like just even places to look so that we can share that with the teams. But yeah, you know, and I guess the other thing we might not get to right now is we were talking last time about maybe like, you know, bundling local grocery services.
Oh yeah, we did talk about that.
Things like that. And so that would be, you know, I think interesting, I don't know, an interesting thing to explore, but basically, you know, there's grocers that usually sell to restaurants and things like that like you have supply right now. And I don't know, you had some really good ideas around that.
In Chicago, there are people who are coming together. So people who deliver food to restaurants are trying to sell it locally to families and deliver it, but they are also connected with someone who makes cheese. And we were talking last time about, wouldn't it be great if they also connected to someone who's making masks, like those homemade cloth masks, and they can connect with someone who's, you know, I don't know, selling a homemade cleaning product, and, you know, maybe some hair dye for us ladies who are struggling, whatever it is. But, you know, lots of local businesses could come together and pool their resources to deliver, like, here's your product, here are your products for the week, or your products for the next 2 weeks. Only a part of that is food, but it's other things that you need. I mean, I know that sort of sounds like what the grocery store delivery services or the Amazon delivery services, but on a very local level, it'd be nice to do that.
And they're overwhelmed. I mean, I know a bunch of people who, like, I mean, we can't even get like a delivery service, like a grocery delivery service right now. So they're overwhelmed. So it could just be interesting to, yeah, like a very local thing, and, you know, connecting, because yeah, I don't know. I mean, it's something to explore.
I think tapping a restaurateur, reaching out to the general manager of a big local restaurant and saying, who are your food suppliers? And are those people trying to put together something to deliver locally? You know, can you connect us?
I'm hoping to get a restaurant owner to talk to this restaurant owner in the next couple of days. But
that'd be a great addition.
Yeah, I have a couple leads. I'm trying to get somebody.
You and all the people that are going to be doing this hackathon, you're doing a wonderful, wonderful thing. I mean, there's a role for everyone to play, not just healthcare workers and first responders. I mean, I didn't think as a doctor I would be sewing homemade masks, but, you know, now I think I've got 50 of them distributed around. We can all help in unexpected ways that we didn't think would be useful. But in a pandemic, everyone's got a role.